In a minute or two before we get to our questions here, 55-year-old cab driver Nicholas and his chief complaints, tearing, redness, and fluctuating vision. So we've got that fluctuating vision again. That immediately makes me think unstable corneal surface, as Cecilia said, evaporative dry eye, MGD, but also I highlight the redness. When I have patients complaining of redness with dry eye, or I'm seeing redness on their ocular surface, I'm immediately thinking inflammation. Now, I think that redness is associated with an inflamed ocular surface. I don't know what it's from yet, but I am thinking inflammation. So look at that redness and link that to the inflammation. We're diabetic, sleep apnea, cigarette smoker, risk factor, risk factor, risk factor, right there. Next slide. You can see the staining on this one. So next slide. And we've got some conjunctival injection. We've got some moderate central SBK, some mild conjunctival staining. I might argue in that picture it's a little bit more than mild conjunctival staining, but we've got elevated osmolarity and a strong point of care testing saying we've got some inflammation. So inflammation in the point of care, osmolarity is elevated, we've got some injection, among other symptoms this patient is telling you, and we are seeing that they need an anti-inflammatory with all of these tests that we are seeing. So next slide. That's a treatment regimen of Xiidra, probably among other things as well. But when you've got that redness, as we've said, we are looking at an anti-inflammatory. Why? Because we've got dry eye symptoms and signs of inflammation. And again, you're going to see this patient back in 4 to 6 weeks. And again, remember those kind of 4 different pillars. That's how I talk about it. Different ways to think about it, as Cecilia said. But are we addressing this? Are we addressing inflammation? Are we addressing evaporation, the meibomian glands, the biofilm, etc., etc.? If you've got inflammation there, we have to address it, and Xiidra is going to do that twice a day.
Indication: Xiidra, lifitegrast ophthalmic solution 5%, is indicated for the treatment of signs and symptoms of dry eye disease. Important safety information: Xiidra is contraindicated in patients with known hypersensitivity to lifitegrast or to any of the other ingredients. In clinical trials, the most common adverse reactions reported in 5 to 25% of patients were installation site irritation, dysgeusia, and reduced visual acuity. Other adverse reactions reported in 1% to 5% of the patients were blurred vision, conjunctival hyperemia, eye irritation, headache, increased lacrimation, eye discharge, eye discomfort, eye pruritus, and sinusitis. To avoid the potential for eye injury or contamination of the solution, patients should not touch the tip of the single-use container to their eye or to any surface. Contact lenses should be removed prior to the administration of Xiidra and may be reinserted 15 minutes following administration. Safety and efficacy in pediatric patients below the age of 17 years have not been established. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Please see full prescribing information at xiidra-ecp.com.